Whose Shoes is about co-production, working across boundaries and involving everyone as equals, right the way through the process. No hierarchy, just people. Anyone can be involved, and the topics we have covered are very varied. I feel privileged to run workshops in many different organisations, different topics, different challenges, but always real, and with more in common than you might imagine. We get to hear people talking through what really matters to them in an open and honest way, not trying to impress the CQC or cover over the cracks. Our most highly developed projects are around dementia care and maternity care, and again within these there are cards for different subtopics, dementia-friendly communities, or perhaps how people living with dementia experience the NHS, what tends to make a difference to them. From our original maternity project in 2015, which fed into the National Maternity Review and helped shape the Better Births agenda, we've gone on to run further projects exploring different aspects of maternity experience and safety. Our Nobody's Patient project looked at 3 specific groups of women and families who all too often fall through gaps in care. Nobody's Patient, a powerful name coming from a woman tweeting to say that this is how she felt. This work naturally led on to Mind and Body, our project around perinatal mental health. And then the big projects spin off into smaller projects, working with hospitals who are particularly interested in exploring, say, smoking in pregnancy, infant feeding, gestational diabetes, or perhaps the role of dads and partners. The need for good communication runs through everything, and a lot of our work focuses on this. We worked with a major children's hospital to develop Whose Shoes resources around improving communications between healthcare professionals, children and young people, and their parents. Truly fascinating. Whose Shoes is currently in use in about 70 NHS trusts, so that's the biggest area of obvious success. But over the years, it's been used by a wide range of organisations, local authorities, universities, social care providers, housing associations, and many more. Some people use it much more creatively than others, and I love keeping in touch with customers, hearing their ideas and often putting them in touch with others who are a bit further along in their journey. For example, Cornwall Maternity Unit run a big annual Whose Shoes event, each time exploring a different topic and putting proper time and effort into not only preparing for it and getting the right people in the room, but most important, following up and ensuring that the conversations turn into positive action. Many organisations do not see Whose Shoes as a one-off type event, but embed it as an improvement methodology into their day-to-day work. Recruitment, training, medical education, monthly challenges. I can give you examples of people doing all of these and more. You can follow me on Twitter at Whose Shoes. I'm known for tweeting quite a lot, but hopefully sharing lots of good practice and generally linking people who are leaders in the world of quality improvement, but who would be even stronger together. In November 2017, an independent study commissioned by NHS Horizons included me in the top 3% of influential tweeters in healthcare in the UK. I'm only mentioning this as I'm not in a position of formal power, and it's sometimes useful for people to see that this is not a prerequisite for becoming influential. A lot can be achieved through helping people and building strong networks. Most of the success of Whose Shoes is down to Twitter and the extraordinary connections it brings, but you have to be open to them and prepared to give more than you get back. I've had opportunities to speak and run workshops in many different countries, and it's all thanks to connections and in many cases now friends whom I've met through Twitter. We were delighted when our Whose Shoes work was highly commended in the West Midlands AHSN Innovation Awards. I've also won 2 HSJ accolades, which is wonderful, and very unexpected, especially as it was quite a few years ago now. But I was particularly chuffed to be presented with the inaugural Citizen Improver Award at a ceremony in Leeds, organised by the Institute for Continuous Improvement in Public Services. Helping citizens, any of us, all of us, to have a voice is what really gives me a buzz. It's always hard to predict exactly what will come out of a Whose Shoes event, but to date, with the right environment, there is always a significant impact. Similarly, it can be hard to measure the impact of qualitative approaches, but this has become easier over time as we hear more and more stories of what has happened as a result of our workshops. We use a system of pledges, and it's been brilliant to see so many heartfelt pledges being made spontaneously at all our events, and the great things that have happened as a result. We've never been particularly interested in counting the number of pledges, but we love hearing about how people are getting on and what happens when they come to fruition. Only this week I was sent a little video made by Gill Phillips, one of the Macmillan programme leads for London Ambulance Service, talking about the tangible outcomes and improvement that had come from the end-of-life care session that we did with them. At the end of 2018, we published evidence about some of our key successes. We will post a link to our blog, What Have the Romans Ever Done For Us?, which is in the form of a slideshow with 12 different themes of our maternity work, linked to the 12 days of Christmas. We did something similar for Advent, crowdsourcing 24 videos from key contributors to our Mind and Body project. People definitely respond to these more creative ways of storytelling. We use videos, Stella stories, Pinterest boards, podcasts, and of course poems. 3 booklets of case studies have also been compiled around some of the more transferable examples of good practice that have happened as a result of pledges made at our maternity workshops. I think the most impressive single outcome from use of Whose Shoes as an improvement methodology was in Liverpool. Consultant paediatrician Joanne Minford has led a co-production programme using Whose Shoes, which resulted in approval to build a new neonatal intensive care unit. The connection to Joanne was made by Helen Calvert, a mother in Manchester whose younger son David had open heart surgery at Alder Hey Children's Hospital. Extraordinary results are happening through tapping into people's individual passions and helping them to take action to make a difference. The Whose Shoes journey is very organic. Things seem to happen as they're meant to, building over time, picking up on new energy, new contacts, new possibilities. For example, a major breakthrough in 2015 was when Florence Wilcott, consultant obstetrician, spotted the work that we'd been doing around dementia care and asked if the Whose Shoes approach would work in maternity care. Together we founded MatExp, which has been an extraordinary social movement combining Whose Shoes workshops across the country and a powerful can-do approach through networks of passionate people wanting to improve maternity care. MatExp was founded around improving maternity experience, but as an obstetrician, safety is paramount for Florence, and she's always argued that experience and safety are fundamentally intertwined, not in any way an either-or. Florence has written about this and will, I am sure, explore this topic further in her insightful and popular podcast series. Florence says,
"Only by tackling the difficult conversations in an equal and respectful way can we improve maternity care. Listening and talking to one another is critical, not only as we work with women, but in dissolving those barriers and difficulties that sometimes exist between different professionals. Flattening of the hierarchy, teamwork, and the ability of anyone to challenge is a well-recognised component of a safety culture. We are doing this both locally, using the workshops and board game, and more broadly via social media and the MatEx website."
Our second maternity project, Nobody's Patient, took Whose Shoes more obviously into patient safety. Nobody's Patient focuses on 3 specific groups of women and families who all too often fall through gaps in the system, which is of course where patient safety is most in danger. Families with babies in neonatal units, women faced with an unexpectedly serious or life-threatening illness in pregnancy or the immediate postnatal period, second trimester loss. Florence Wilcock and I were invited to run large workshops at the launch of the Maternity and Neonatal Safety Improvement Programme in Westminster, and the resources were made available to all the hospitals who were using the Whose Shoes approach in their maternity units. I think there's still scope for maternity teams to use these resources more comprehensively. The tendency has been to run workshops using the original maternity resources or, more recently, the perinatal mental health resources. It's harder to lead events where the responsibility falls between a number of providers, but this is where the real progress will be made. So Whose Shoes can improve patient safety by providing a powerful mechanism to bring people together from many organisations, meeting face to face with the women and families they serve, both to help prevent incidents but also to learn together when things have sadly gone wrong. We are currently working with SANS UK, running Whose Shoes workshops to test out the National Bereavement Care Pathway and identify any gaps. There's already been an event in Colchester just before lockdown, and we're currently planning a virtual event with the maternity team in Gloucestershire to build this work further. I think there's scope to use Whose Shoes to explore and improve patient safety investigations, especially in terms of human factors, learning what went wrong, but also to understand the experience of all the people involved, the bereaved or damaged families, the healthcare staff facing a barrage of emotions, and indeed the investigators themselves needing to improve their process and subsequent sharing of learning. Some organisations have been exemplars in reaching out and collaborating with other organisations. I've been particularly proud to work with the London Ambulance Service, and I'm delighted to see that they've been shortlisted in 5 of the HSJ Patient Safety Awards 2020. We've run Whose Shoes workshops with London Ambulance Service, looking at the role of emergency services in 3 areas: maternity, mental health, and end-of-life care. 3 totally different topics, but all involving people at extremely vulnerable times in their lives and with fascinating learning. And now I've been able to link Florence Wilcock with the Patient Safety Learning Hub, and her important podcasts are now being featured on the Hub, giving others a real insight to the life, thoughts and challenges of a FabObs. A FabObs is the hashtag we use on Twitter for an obstetrician who's passionate about improving maternity safety and experience. There is a danger of stereotyping. Patient experience can be seen as fluffy and warm. Patient safety is something where mistakes can be eliminated if only we could get the right process and the right checklists. But human experience and factors like fatigue and being undermined, not feeling confident or supported to speak out, run through everything. There is a danger of preaching to the converted. I remember once Florence and I were running a maternity experience event, and she said that a number of people couldn't come who she'd like to have been there. Apparently there was a clash with a more science data type event. I remember suggesting that perhaps we could swap the delegate lists, as sometimes the biggest outcomes are achieved when people attend an event which is outside their immediate comfort zone or area of obvious interest, and they hear something that really makes them stop and think. I'm looking forward to starting to explore these ideas further at the forthcoming partnership event that we're running with the Patient Safety Learning Team for World Patient Safety Day. The places were snapped up on the morning the session was advertised, so there certainly seems to be an appetite to explore the potential of using Whose Shoes further in the world of patient safety. I'm also in conversation with investigators and regulators, so watch this space over the coming months.